I'd be interested to hear your thoughts to share, as I've worked with you for like over 10 years and seen some different transformations, not just like teeth, but even just knowing you personally, like career, and now you're like retired and enjoying life. So tell us a little bit about what you've done.
Well, I first come your way for the sleep apnea. I'd done some sleep studies and I was claustrophobic, so I couldn't wear the mask at night. You had the solution of the appliance that pulled my jaw out. That seemed to take care of it, and it also took care of me not. I had some crowns in the front, and the dentist I had before couldn't figure out why they were coming out, and they were grinding them out. And that sleep appliance took care of that too. It was a double thing. I couldn't keep my teeth in my mouth, plus I couldn't sleep.
Two important things, eating and sleeping.
Right.
So I think that resonates with a lot of people, because if you don't sleep well, we're not our best self. We can't enjoy life. And especially people that have had a sleep study or an actual diagnosis of sleep apnea, they want other solutions like the mouthpiece hold your jaw forward. So it basically hold your jaw forward where you can breathe and you don't grind your teeth. Maybe you want to share with people how now, from what you know in your experience, why did they wear down now from your perspective?
I think I was just grinding them out because, as you pointed out to me, my jaw was not properly aligned.
Curious on this. So most people, sleep, it doesn't just affect you in your life, but like your family, maybe put a little bit of thoughts on what your spouse said and gave you feedback.
When I got the sleep appliance, it changed her world because she could sleep at night. I wasn't making noises and snoring, and it was a game changer. It was, and I think my new teeth are a game changer because my jaw is repositioned now, and my breathing's better, and that's helping my claustrophobia too. I haven't breathed this well in, I don't know, ever.
That's, I think, my big takeaway from working with you. Like, that's another what someone wouldn't expect, right? By you can wear a mouthpiece for sleep apnea and you can protect your teeth. Another tier up is build up the teeth that were worn down. But another kind of unexpected surprise is how when your face and your jaw are balanced, it actually does impact your sinuses.
It does.
If you had a recommendation a few years ago, and you know how for most we're busy working and other life goals, why now would have been the right time to do maybe a more permanent solution or not just a mouth guard?
I think we started out as my old crowns were starting to fall out, and it was time to do something. So I thought it was time to just fix it all. You did it in stages. You give me the bottom half and then the top half, and then it's a lot easier now because my jaw is where it's supposed to be, and I'm used to it being there now. I did it mainly for the sleep apnea, but the great looking teeth are a big bonus for me because my teeth didn't look so good. Now I just smile.
Smiley.
So smiley.
Yeah. Definitely for you, I think the health benefit. And I think for a lot of people nowadays in the culture and how they're looking at their diets and breath and sleeping, that's everyone's primary focus. But when you can put the cherry on top, that's the best.
It's been a life changer so far.
Mark, what do you think that someone else would want to know? Like if you're working on all your teeth, how did you feel like relaxed or comfort measures that our entire team did?
I was not relaxed at first because I was afraid I would have terrible headaches. I was afraid, and it wasn't that way. I mean, I woke up, I felt fine. I was a little groggy from the anesthesia, but I was in no pain at all. I took no aspirin, no Motrin. I didn't take anything, and I was not in any pain whatsoever. And that's what I dreaded more than anything of the side effects. And it was there were none. You all made me feel comfortable. It was. You told me it would be that way, but I didn't quite believe it. but
Yeah.
it was that way.
That's the best compliment, I think, when you work with someone. And if you're working on not just one tooth, but all the teeth, many people that I work with are like, oh, how do you fit all that together? So just to back up what you said, I think it's having a well-organized team to make that happen and deliver the care where the next day, it's easy.
Yeah. And dreading it was 10 times worse than doing it. Doing it was a walk in the park. She's very calming, it's going to be all right. I never thought my breathing would be better by having dental work. I mean, I never crossed the two together. It's all a part of your health, and she taught me that. And it's been a good experience. I never thought that having dental work would make my breathing better, and getting a good night's sleep makes a big difference in your day. And if you don't sleep, you get headaches if you don't sleep all night, or if you quit breathing at night.
Yeah.
I've got a lot of friends that wear that nighttime appliance, and they can't sleep without it now. Dr. Coates has given me a solution that I can live with. It's changed not only my life, but it's changed my wife. She likes sleeping at night too.
Yes. Happy wife, happy life.
Happy life. There you go.
For me, specializing in this lane of dentistry has been very rewarding because it's not just about a crown at a time. You really have to help encourage your patient, support them, educate them about the process that one or two crowns will not balance you. It really has to be a thought out, balanced approach for your teeth, your jaw, and your airway. And so that's what we're about with our entire team, is to educate our patients, give you the best solutions, and focus on the total holistic package. So I want to thank you, myself, and my team, because it takes a special kind of patient to trust the process, and it's a relationship thing too, right? Not just work on your teeth, but I feel like we've become part of your dental family, as that's our goal for our entire team. And then it also requires like your spouse or your wife to even trust us to work on you and help you, because, well, it's sedation and new crowns. And so it also has to be the trust of the spouse that's supporting you to be able to have a win. So I do want to thank both of you for that.
You and your team are the best. And that's
Thank you.
I would send anybody your way.
Thank you for coming in and sharing your story and helping others like you. That means a lot.